You might have seen someone with a large amount of swelling on the back of their elbow. Maybe you have had that. What is that and how can you get rid of it? In this video, I'll explain Olecranon bursitis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Olecranon bursitis is not all that common, but it's pretty impressive when you see it. And it typically is a large, almost like a balloon on the tip of the elbow. Sometimes it can be very small. Sometimes it can be really big. I had one early in my career where I had to cut out. I mean, it was huge. I mean, I can't even begin to describe this mass almost, this fluid collection on the back of the elbow. Now, bursitis basically means swelling of a bursa. And there's a bursa right along the tip of your elbow, your olecranon, that's there in all of us. Now, it can be paper thin in most of us, but for some reason, in some people, repetitive motion or usually direct pressure on the elbow, that can get irritated and inflamed and that bursa swells. Typically, I've seen it in truck drivers that are basically resting their elbow, I guess it'd be against the driver's side window or maybe the center console, or people that have to put a lot of pressure on their elbows, maybe manual laborers like carpenters or things like that. It's typically who you see it in, but it can be, in theory, it could happen to just about anybody. Now, typically, if you just avoid direct pressure for a period of time, avoid the repetitive motion, it can clear up on its own. Maybe some anti-inflammatory medications, maybe some ice might help that calm down. Maybe a pad on your elbow, like an elbow pad, to prevent direct pressure on the olecranon. If that's enough to get it to work, fantastic. Typically, if you go in and just try to draw the fluid off of it, that doesn't work that well, because if you were to ever open it up surgically, it's not just one envelope, one consistent area. It's almost like if you can imagine a honeycombed appearance, like a beehive, and it's all these loculations within the bursa that hold the fluid in compartments, so you just can't get it all out, and that doesn't typically work that well. In the past, doctors have tried injecting cortisone into it to stop the inflammation, and that can help, and if it works, you do it once and it works, fantastic. I am not a huge fan of steroids generally for different reasons, but in this case, especially if somebody does it over and over again, I have seen a number of patients that got basically that olecranon bursa got infected because somebody else had injected cortisone over and over again. And then once that bursa gets infected, what's called a septic bursitis or a septic olecranon bursitis, that's something that needs to be treated urgently with surgery. And so that would be something you'd really want to avoid. So I'm not huge on cortisone, even though I know sometimes that is done. If it's not getting better with the simple things, it would involve a surgery basically to open that up and taking the bursa out. And that can be a fairly small surgery. I mean, it's going to be probably outpatient regardless. How big of a surgery and how big of an incision really depends on how big that bursa is. It's not a really significant recovery. You're not messing with the bones or the tendons or ligaments or muscle. You're just taking out that fluid-filled sac. So that can have fairly good success rates. But hopefully it isn't, at least in your case, something that you end up needing surgery for. Again, the success rates can be pretty good if you can avoid direct pressure on that olecranon bursa. I'd love to hear about your history with olecranon bursitis if you've had it, or whatever your elbow injury is. Leave those in the comments below this video. Just understand, if you leave a question where you're asking for medical advice, I can't give you medical advice on social media, basically. So what I do is I take that topic and try to address it in a future video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video or start a new live stream, like my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.